Hi, I'm Lawanda Pulley, and I'm here again with another segment of The City Speaks. We've done a lot of episodes about COVID and talking about different things regarding to COVID. And now with all the mass testing and stuff that's going on around the country, where it's been opened up to everybody, I just wanted to take some time to do some little talk or a little bit of explanation about actual testing for COVID and try to help you understand as medical professionals the different tests and what they're actually telling you. So let's start off by talking about the nasal swab. You need to understand that a nasal swab will only show you actual present infection. It will not tell you whether you've ever been exposed, whether or not you have an oncoming infection or anything. So you have a really small window of opportunity for diagnosis when you take a swab test. Then they have a little finger prick antibody screening. That finger stick will actually tell you whether or not you've ever been exposed and whether your body has developed any antibodies according to recovery. There's also another blood test. The blood test that we use here in the Halo Hands Family Practice Center is a test that comes out of the AccuReference laboratories out of Linden, New Jersey. They were at the Epic Center for New York at Ground Zero when they developed their method. What we actually do here is we take a 3 cc blood draw and we screen it. This blood draw tells us a lot more. I can tell you so much more. So I'm putting up a little drawing. Please don't talk about my drawing now. I'm not an artiste. My expertise is not in drawing or anything, but I want to try to explain to you some of the things that I use or that I interpret with the results that we get at this facility and how it comes into my diagnosis of you, your COVID, whether you've been exposed, whether you're sick, whether you're recovered. So I need you to take a look at this picture for me, okay? So there's going to be a picture that comes up, and now I'm going to try to explain this to you. So at the bottom of this graph, it says day 0, day 7, day 14. So let's look at this as this is from the time that you came in contact or you were actually exposed to the virus. So just like any other disorder, when an infection comes into the body starts to respond. So it responds in a matter of producing something that's called antibodies. So the initial antibody that is activated when you first get the sign of infection is called an IgM. So you can look at IgM as immediate infection or immediate response from the body. So it takes anywhere from 7 to 14 days for this level of IgM in your body to show as positive. Before we get to the positive stages, it goes through another phase here from the 0 scale up to the positive. Well, I get a reading in there. It either says negative for saying that you've never ever had any exposure, or it gives me a preliminary number saying that yes, you have been exposed and you have COVID in your body and it's growing or it's just not to the point where we can say that you've had a diagnosis. Now, all of this occurs to the left side of this blue line that's in the picture. So this blue line in the picture represents IgG. So you look at IgG as being gone, okay? So what happens is after your body makes an initial response, the body starts to build its defense system. or what you might want to call the IgM. So the IgM starts to appear somewhere between 7 to 14 days after the initial infection starts. Okay? So as the red line goes up, we get to a point where it is conclusive to make a diagnosis. So generally, if I get a result that says you have been exposed, which means that you are building on or the infection is oncoming, it makes you about to be positive with COVID. So at this point, it is a good thing to know that you need to isolate anytime your IgM shows anything other than negative on the left side, okay? So then we go through a part where it goes from being a borderline, or it shows that you have some infection, to above the positive line. Okay, so when you're above the positive line, this is where your nasal swab will also show the positive. And that is the only part that the nasal swab shows. It doesn't show your pre-exposure. I can tell your pre-exposure and predict between 7 and 14 days when that nasal swab will turn positive. We have done it in this facility for numerous patients. So after a while, after the infection has run its course in the body, the IgM starts to decline, or you go into recovery. Okay? So the IgM starts to decrease and come back to normal. And the blue line, or the antibodies, the IgG, starts to rise to show, yes, we were affected by this. And so as one comes down, the other increases. In a normal person, or a normal reaction to the infection, once you have recovered, this blood screen will show me that your IgM is negative, but your IgG is positive. So I know there have been some people that I have telephoned with their results, and I tell them, yes, at some point in time, you did have COVID, but you have none active in your body now. And this is how I can tell that between these test results. So when you have fully recovered from COVID, your antibodies, IgG, saying that it's all gone, remains positive. But your body's immediate response, which is the IgM, should return to a normal level and be negative. So this is how all this plays out. This is what I use to interpret. This is what I use to diagnose. It has been very accurate for me. It has a very high specificity, for this test method. I am trusting it. I am trusting my diagnoses. All the patients that I have predicted, and they'll tell you, I've been spot on. Can't give you any names, but I have records to prove. So don't be alarmed if somebody tells you that taking an antibody test is not an accurate method for telling you whether or not you have COVID. They're absolutely wrong. Lots of hospitals now are using antibody screening instead of nasal swabs because the accuracy in diagnosing and treating gives them such greater advantage over just having a nasal swab. Do your research. Do your homework. I'm not saying I'm the authority, but I'm not. Okay? I just know what has been going on in the persons that I have been testing, the results that I have been seeing, and the recovery of the patients that I've cared for with COVID. By all means, we encourage everybody to be tested. Know whether or not you're positive, know whether or not you've ever had it, and don't think just because you had it one time, it does not come back. This is not true. Reinfection can happen. It has happened. And the signs and symptoms are constantly changing. I know in the beginning we talked about the fever and the cough. Well, the fever and cough are gone. If that's what you have, then that's not what's out right now. So we have progressed now. There are some people who are presenting, especially in young teens. I've had several young teens who only had a headache. That was it. Just an unexplained headache for a number of days and just not feeling well, just feeling run down, and they were positive. I've had people show up at my clinic, no cough, no fever, just nausea, vomiting, and diarrhea. They were positive. So our patient's presentation is changing. The virus that we're seeing is changing. So if you've had any nausea, vomiting, diarrhea, just feeling tired, not yourself, now is the time. You know, COVID is on a rise, and they said this wouldn't happen until the fall. Wow. It's here, and it doesn't look like it's going anywhere anytime soon. So, my advice, get tested. You know, I know that even in getting tested, as I've encouraged you to get tested, lots of people have come to the clinic from far away as Goldsboro, saying that other places that they went told them it would be 7 to 10 days before they could get them a result. Well, the test that we do here at the Halo Hands Family Care Center takes 48 hours. So we have our results back in 48 hours from our lab. Everything is done electronically. So if you need a test in a hurry, you know, we can give you a turnaround in 48 hours. Know your status. You know, take a little proactive step. Don't just do a nasal swab. Know more about whether or not you have the active infection. Protect yourselves, your families, your loved ones, and the community. It's time for us to get ahead of COVID. I thank you for stopping by. Please direct all questions to the website. We'll be more than happy to talk to you. If you got a question about anything in the broadcast, I'm more than happy. Call the office, 252-210-3093. We're here opening every day, Monday through Thursday. Walk in, get your tests done. Let's get a handle on COVID. I thank you once again. This is The City Speaks, and I am Lawanda Pulley.